Hello, this is Dr. Marc Rothenberg from Cincinnati Children's Hospital. I'm the director of the Allergy Immunology Division in the Cincinnati Center for Eosinophilic Disorders. I'm also the proud recipient of generous and kind and critical donations from the CURED Foundation. Today I'd like to just briefly tell you about our work focused on eosinophilic disorders. Eosinophilic disorders are diseases that are primarily associated with eosinophilic inflammation. Now, what's an eosinophilic inflammation? Eosinophilic inflammation is swelling of different tissues in the body, primarily the GI tract, associated with and caused by eosinophils, a type of white blood cell normally associated with allergic problems. Eosinophils are classically thought to protect against different types of germs, particularly parasites. But in the case of allergies, eosinophils get mistaken and they react to substances such as food and induce problems to the host, an individual with various forms of disorders that we now call eosinophilic disorders. The most classic type over the last decade has been EGID, eosinophil GI-associated disorders, which we will help describe and coin this term. Eosinophil GI disorders, EGID, affect different segments of the GI tract, starting off from the top of the GI tract, the esophagus, and going all the way down to the intestine and colon. Depending upon what segment of the GI tract is involved, there will be different presentations, different symptoms. Classically, patients can have nonspecific symptoms, including difficulty growing as a child, difficulty with abdominal pain, failure to absorb nutrients, sometimes resulting in direct malnutrition. As people get older, symptoms can include certainly diarrhea, difficulty swallowing, as well as food getting stuck in the esophagus, and certainly a variety of generalized symptoms associated with chronic inflammation, a variety of difficulties associated with concentration, potentially and certainly poor quality of life due to the medications that we sometimes use, but also due to the dietary treatment regimens that we have. We have shown over the last decade that eosinophilic GI diseases are primarily caused by food allergy. Now, it's not the classic type of food allergy associated with anaphylaxis, such as peanut allergy, which causes an acute reaction. Eosinophil GI disorders are primarily chronic swelling or inflammation caused by the immune system adversely reacting to food. Unfortunately, compared to standard food allergy, eosinophilic GI disorders involve sensitization to multiple foods. So poor people suffering from this disease, particularly children, are often sensitized, allergic to many foods, leading them to have a greatly restricted diet because avoidance of those foods can indeed result in resolution of the symptoms. Eosinophilic GI disorders are chronic, but they are ones that can go into remission. Indeed, the chronicity becomes a major problem because the disease waxes and wanes, particularly will relapse after restarting, after taking away different treatments, particularly advancing the diet or withdrawing medications. At present, it's important to diagnose eosinophilic diseases because our research has led to clear treatment options, particularly related to diet or the introduction of anti-inflammatory medications. Most common anti-inflammatory medication used to date is glucocorticoids or steroids such as prednisone, but more commonly topical steroids such as asthma inhalers. These medications are effective, but they aren't a great long-term option. So our research is focused on developing new ways of treating the disease based on understanding molecular mechanisms of the disease, the particular molecules and genes, and then understanding how we can block the symptoms of the disorder in preclinical settings, but now advancing onto clinical trials. Symptoms are very key to control so we can improve quality of life. At present, the diagnosis of these diseases is strictly made by examination of eosinophil counts, often with an eosinophil GI disease that involves specific biopsies of the intestinal tract through endoscopy. This is an invasive procedure, and because it's the only non-invasive, it's the only tests that we have for the disease, it involves recurrent biopsies, often quite frequently for the people suffering from these diseases. A lot of our research today is to develop non-invasive biomarkers to both assess disease susceptibility and risk when screening the population, but also to monitor disease status as we improve treatment and then hopefully reduce the number of endoscopies. Now, I just want to close by thanking CURED, the Campaign Urging Research for Eosinophilic Disorders, particularly Ellen Kodroff and her wonderful board of very dedicated and kind individuals in the large community across the United States have been mobilized by CURED to help fund our research. Research today is fantastically exciting because we have so many different amazing approaches to treat diseases. Yet at the same time it's frustrating because we're limited by the financial crisis in the government, which funds most of our research, and also because of the rising cost of sophisticated new cutting-edge technologies. Although we have grants, we are one of the select groups that develop grants today. It's very difficult to obtain grants from the government. The grants are limited, and they do place blocks on the types of research we could do, particularly when it comes to new diseases like EGID, but also when it comes to using cutting-edge, high-risk technologies to approach the latest treatment and ultimate cure. Having substantial extra funds from the CURED Foundation has provided us with a huge opportunity to make discoveries, to translate them into action for patients, and ultimately to develop the cure. Our research is published regularly. We publish nearly dozens of articles per year. This means that the rest of the world gets ready access to our findings, and hence the effect of CURED is not only here in Cincinnati, but it's around the world where investigators and clinicians can learn from our results, but also contribute by using the findings to substantiate their own hypotheses about the disease. And ultimately, I believe that the cure will be based on the collective wisdom of the whole scientific community. Hopefully, we'll see that soon. So thank you so much for your support. I encourage you and urge you to continue to support CURED. This is a wonderful cause, and in addition to providing funds that are saving our research and allowing us to sustain it at a high level, it's a great inspiration to know the individuals behind CURED, but also to see the dedication that you have to raise the funds and the importance of our research. So this provides us with both financial opportunities, but also personal inspiration to myself and to my research team. It's highly dedicated to solving the mysteries of eosinophilic disorders.